gentlemen. My name is Dr. Aaron Geswaldo. I am one of the urologists at Lovelace Medical Group here in Albuquerque. I specialize in men's health, and I've been helping men with their lower urinary tract symptoms for over 20 years. My goals are to treat not only your symptoms, but to correct the cause of the disease. My practice was recently designated as a Center of Excellence for the treatment of BPH using Boston Scientific's green light laser technology. Boston Scientific generously designated this limited recognition not only based on the number of men we treat, but also the outcomes achieved. I specialize in a number of different treatment options, including medical, minimally invasive therapies, and surgical procedures to treat an enlarged prostate and its issues. So the prostate is in line with your lower urinary tract symptoms. Your lower urinary tract consists of the bladder, the prostate, and the urethra, which is inside the penis. The bladder collects the urine. As it squeezes, urine is forced through the prostate, indicated here within the circle, past the prostate into the urethra and ejected out of the body. So what this picture is showing is a normal sized prostate on the left. Urine is able to pass through the center of the prostate as the bladder squeezes. On the right, the prostate is enlarged. It takes more force to get the urine through the center of the prostate. This enlargement is resulting in an increase in lower urinary tract symptoms. Benign Prostatic Hyperplasia, or BPH, is a condition in which the prostate enlarges as a man gets older. BPH is a very common condition that affects nearly 40 million American men and over 500 million aged men worldwide. Over 40% of men in their 50s and over 70% of men in their 60s have BPH. While BPH is a benign condition and unrelated to prostate cancer, it can greatly affect a man's quality of life. As the prostate enlarges, it presses on and blocks the urethra, causing bothersome urinary tract symptoms such as frequent need to urinate both day and night, weak or slow urinary stream, a sense that you cannot completely empty your bladder, difficulty or delay in starting urination, urgent feeling of needing to urinate, a urinary stream that starts and stops. So what causes the prostate to turn from a normal prostate to an enlarged prostate? Well, it's a histological diagnosis. There's a proliferation of smooth muscle and epithelial cells that occurs within the prostatic urethra. Now, the reason isn't exactly known, but the etiology is mostly related to testosterone. Usually starting around 40 to 45 years old, the prostate starts enlarging, secondary to testosterone. Now, the enlargement of the prostate is what's causing the symptoms, and it either is directly because the enlarged prostate is pushing on the surrounding tissue, or there's an increased smooth muscle tone and resistance within the enlarged prostate gland. Either way, it gives you the symptoms as we described before: urgency, frequency, hesitancy, nocturia, slowing of the urinary stream, and incomplete bladder emptying. So treatment usually starts off conservative, and it usually starts off by the patients themselves. Patients usually undergo a lifestyle change, such as fluid restriction or avoiding certain substances that have diuretic properties. A diuretic property is a thing that makes you go to the bathroom more often. Sometimes people start an over-the-counter medication or supplement, such as sal palmetto. There are multiple different products that exist out there, and they may or may not help with your mild lower urinary tract symptoms. The medications that can be prescribed by a physician include most commonly the alpha blockers and the 5-alpha reductase inhibitors. The alpha blockers, otherwise known as Flomax, tamsulosin, or doxazocin, work by relaxing the proliferation of smooth muscle cells that occurs within the prostatic urethra and bladder neck area. The relaxation causes a wider urethra, and more urine can flow out of the bladder. Some common side effects are lightheadedness, dizziness, sometimes blurred vision. Few men may experience a runny nose or stuffiness with breathing. Another common medication, the 5-alpha reductase inhibitor, such as finasteride, works by blocking the conversion of DHT within the prostate. Over time, this can lead to shrinking of the prostate. This medication may have other side effects, such as erectile dysfunction. Its efficacy is also low, and meaning that some men have no effect by taking it. Anticholinergic medications are often employed, and these are known as, most commonly, oxybutynin. This works on the muscle cells themselves and causes them to relax, and you have thus decreased contractions. These medications may have some side effects as dry mouth, dry eyes, and constipation. Occasionally, this type of medication can also lead towards going into worsening of your symptoms or urinary retention. So there are some scenarios when medical therapy is bypassed, or maybe you want to avoid taking a medication. There are other treatment options that are available if medications don't work anymore, or you just want to avoid them altogether. When there's an indication to undergo a surgical procedure for BPH, there are multiple different treatment options. It's important to have an intra-office consultation with your urologist. After a physical exam, PSA analysis, urinalysis, evaluation of labs, a possible cystoscope, and other imaging studies may be done before your procedure. After the consultation, you and your surgeon can agree upon what is the right procedure for you and the reasons behind that. For the rest of this lecture, I'm going to go over 4 of the surgical procedures that we do in our office. These include the prostatic urethral lift, otherwise known as the Eurolift procedure, the water vapor therapy, otherwise known as Resume, the laser vaporization procedure, has a trade name green light laser vaporization, and the laser enucleation technique, which can either be done using the green light laser or the holmium laser. So sometimes you can refer to these 2 types of procedures as the green light enucleation and the HOLAP, or the holmium laser vaporization procedure. So the first procedure, the prostatic urethral lift procedure, or otherwise known as Eurolift, is a minimally invasive technique that's done in the operating room here at Lovelace that generally takes the surgeon about 10 to 15 minutes to complete. Under a light anesthesia, the instrument is inserted in the reverse direction the way the urine comes out. So the device goes into the urethra and into the prostate. This device will deploy a small surgical clip that, if you placed it at the 3 and 9 o'clock positions inside of the prostate, lifts it up and out. And by doing so, increases the width of the channel that goes through the prostate. Each surgical clip is tiny and is made of a metal polymer that is long-lasting. It kind of works on the concept of a drywall screw. When you're trying to hang something off of a sheetrock, you put an anchor bolt on one side of the sheetrock, and it's tethered to another anchor bolt that goes on the outside. So think of the Eurolift as something that is deployed from the inside of the prostate, deploys its anchor bolt to the outside capsule of the prostate. The outside capsule of the prostate is a tougher material, which allows it to be anchored in, and it's tethered to another surgical clip that can then be placed on the inside of the prostate. Usually it takes about 4 to 6 of these small surgical clips to be placed inside the prostate to complete the procedure. So this is the Eurolift device. The Eurolift device is a disposable instrument that deploys an implant within the prostatic urethra and is done through a small needle that goes from an inside to outside fashion. This small needle deploys the Eurolift device between the 2 and the 3 o'clock position, and on the other side between the 9 and 10 o'clock position. What's important about the positioning of the implant is that it avoids the major blood vessels that supply the prostate and the nerves that supply the penis, giving it its ability to have an erection. So what this is showing on the first picture on the left shows just an enlarged prostate. The Eurolift device is inserted into the urethra, and then the implants are deployed laterally out in the 3 and the 9 o'clock positions. And the last picture on the right shows 4 of the implants placed into the prostate. So this is a video that follows just showing how the Eurolift is done in a graphical form.
The Eurolift system is a proven minimally invasive technology designed to relieve urinary symptoms and improve quality of life with minimal side effects for men with an enlarged prostate caused by benign prostatic hyperplasia, or BPH. The Eurolift system procedure begins by inserting an implant delivery device into the urethra. An attached endoscope provides visibility to the obstructive prostate. On reaching the area blocked by the enlarged prostate, the obstructive prostate tissue is moved aside. Following a trigger press, the device inserts a fine 19-gauge hollow needle across the prostate and deploys the implant through the needle. The implant is a nylon suture fixed in place with a thin metal tab at each end. Depending on the prostate size and blockage severity, the doctor inserts several more implants the same way. Typically, 4 to 6 implants are placed into the prostate. The outer capsule of the prostate is firm and provides a solid anchor, which allows the implants to lift and hold the enlarged prostate tissue out of the way so it no longer blocks the urethra. As the sutures are shorter than the prostate depth, the prostate laterally compresses. This reduces pressure on the urethra and provides immediate visible results so urine can flow freely.
So what we're looking at here is from an actual case. And this is the view that the surgeon has while he's looking through the endoscope, which is the device that allows us to see within your bladder. This metal thing in the that's running horizontally across the screen is the Eurolift deployment device. And what we're doing is deploying a surgical clip into the lateral sides of the prostate. As each clip is placed, it tenses the urethra laterally and out. You can see on this, and this is on the right side of the prostate, the urothelial clip is going to be placed and it's deployed right there. It's advanced, and the one clip that's going to be placed on the inside of the urethra is then placed and deployed. So the next procedure is the resume procedure. The resume procedure delivers its energy by heating water into steam. The steam that's injected into the prostate causes tissue ablation. After the tissue is ablated, the body reabsorbs this tissue, causing a physical defect through the prostate. Rather than pushing it up and out of the way, such as the Eurolift, the resume has a more durable effect, long-term effect, that results in lower urinary tract symptoms. So the resume procedure is also a transurethral procedure. Each treatment takes 9 seconds. You can do multiple treatments in one session. This is done again in the operating room for comfort. So using this handheld device, it's placed in the reverse direction the way the urine comes out transurethrally. Once the tip of the device is within the prostate, a small needle can be deployed into the prostatic tissue. A treatment cycle is begun, and it takes 9 seconds for it to go through its treatment. Multiple treatments can be completed during one operative session. The typical prostate usually takes between 2 to 4 treatments to treat the tissue effectively. Therefore, a trip into the operating room is actually less than the Eurolift procedure using the Resume. Again, I have included a graphical representation of a treatment in the operating room.
Powered by convective wave technology, Resume is a fundamentally different way of applying thermal energy to safely and effectively treat lower urinary tract symptoms secondary to BPH. Each 9-second treatment uses 0.42 milliliters of radiofrequency heated sterile water vapor, which rapidly and uniformly disperses through the tissue interstices. The condensation of water vapor releases stored thermal energy. Cell membranes are gently denatured, thereby causing immediate cell death. The vasculature is closed, and there is denervation of the alpha-adrenergic nerves within the treatment zone, providing you with an efficient, uniform, predictable treatment. Over time, this ablated tissue is resorbed by the body's natural healing response, reducing the volume of tissue, allowing the urethra to open, relieving lower urinary tract symptoms.
So, one of the things I truly love about treating men's lower urinary tract symptoms is the chances when I get to use the green light laser. I've been using this technology since its inception back in the early 2000s during my residency. And I've seen multiple different generations of this unit as it's, as time has gone forward. And it's really become a precision tool for me in the treatment of BPH. Virtually any prostate I can operate on using this laser, and some of the smaller ones that require minimal amount of treatment versus all the way up to very large glands. And up until, in the past, we would have to operate on these people in an open fashion. Well, we're removing glands that are 150 to 200 and above gram size. So these very large prostates, men get a minimally invasive procedure. They're out of the hospital quicker and back to their normal lives sooner. Boston Scientific has designated my practice at Lovelace Medical Group a center of excellence in the green light laser technology. It's the accumulation of many years of using this and the experience and the outcomes that I've been getting.
So this is a video of the green light laser in action. It's a transurethral procedure. It's done under general sedation in the operating room. Generally can take anywhere between 30 to 45 minutes up to about an hour and a half. And as you can see, this is done through what we call a cystoscope into the prostatic urethra. So it's in the reverse direction, the way the urine comes out. The laser fiber is sticking out in front of the scope, and you can see as the laser hits the tissue, it ablates it or vaporizes it, and causes basically coagulation of the blood vessels. So there's not a lot of blood loss, if any. Now, it does have a different mode. If there is a blood vessel that's encountered, you can use this special pulsatile mode of the laser, which helps coagulate. So this defect that goes through the prostate removes the tissue, it ablates it, and you're getting rid of the adenoma part of the prostate that grows. And this tissue may be affected. The obstructive nature of of the prostate growth can be causing the lower urinary tract symptoms, and just having such an abundance of smooth muscle in that area may also cause you to have some of your symptoms. And basically by ablating it and getting rid of it, you're getting down to the capsule. The chances of reoccurrence is significantly lower. There's a very high satisfaction rate with doing an ablative procedure like this, and generally very low complication with no bleeding. The depth of penetration is not that much, so your healing time is actually very improved. Usually you stay overnight in the hospital with a catheter in, and you are discharged the next day. Major majority of people go home without a catheter. Major majority of people go home without any pain medications. Just Tylenol or Advil is really all you need after a procedure like this. The men have some urgency that usually lasts a few days to even 1 or 2 months afterwards. And that urgency is just the healing process that's going on within this ablated tissue area.
What happens if you have a very big prostate? We measure prostates in gram size, and generally the laser vaporization procedure works well on prostates that are above 35, 40 grams and up to about the area of about 80 grams. But as you saw in that video before, the laser energy is hitting the tissue, and there's a lot of energy transfer into that tissue the larger the prostate. Just kind of think about it: bigger surface area, bigger, more amount of energy that's transferred to the patient. So traditionally, when a patient would come in with a larger prostate, and what we would tell them is that it becomes a certain risk versus benefit ratio where the larger prostate would better be removed by a surgical procedure, such as a simple prostatectomy. Basically going in through an incision in the lower abdomen, cutting open the capsule of the prostate, and then removing the adenoma that way. Now this works well and has good outcomes, but it is an open procedure where you have a surgical wound. There is a catheterization that's required for about 2 weeks after this procedure is done. There's considerable more pain and discomfort. There's a lot more blood loss by doing an open procedure. So one of the things that I get very excited about doing is the laser enucleation type of procedures. And you can use a green light laser to do this, or the holmium laser to do this. And what you're doing is the same operation that you would do in an open fashion, but still using the natural pathway of your body, going through the urethra in the reverse direction, the way the urine comes out, and basically shelling out the inside of the prostate. Think about it this way. If you were going to go into the core of an apple, and that is representing the apple representing your prostate, and the core of the apple is your prostatic urethra. And if you were to take an instrument and just shell out the inside of the apple without breaking the skin. And this is what the laser enucleation procedure does. So what we're looking at in this picture is actually using this laser to cut through the tissue. You can see it's relatively bloodless, and you can shell out the inside of the prostate into left and right median lobes, left and right lateral lobes, and a large median lobe, and extract this tissue at the end of the case. Less energy is transferred to the patient. Healing time is better. So what was once a very extensive operation requiring a lot of recovery can be done on these larger prostates, and upwards of above 100 grams, above even 200 grams, and minimize hospitalization time, catheterization, blood loss, and recovery. So a little bit about the physics of these lasers. Basically, if you take a laser and bring it closer to tissue, more of the energy is going to be transferred to the tissue. You move it farther back, and a lot of it's going to be dispersed. So this precision device will only work in the area that you want it to, and you won't have a lot of collateral damage. So that's why in the past, when you used to do an open procedure, that person would be recovering for literally weeks or maybe even months with an open incision. But nowadays, using these lasers, you can recover in a few days because the lack of collateral damage to the surrounding tissues is much less.
So what we're looking at with this picture is the preciseness of the laser. And you can see that laser energy is transferred to that tissue and cuts right through it. But the surrounding tissue blanches very little. And you can see how this laser is being used as a surgical instrument. It basically goes in, finds an avascular tissue plane, and we can kind of exploit it and then shell out the prostate. And this technique really results in quicker wound healing. Patients have great results, and minimum damage to the surrounding tissue, meaning less complications and side effects.
So in conclusion, there are a lot of different treatment options. By offering all of these different treatment options allows me to pick the right treatment to ensure improvement of your lower urinary tract symptoms. A lot of these techniques are exclusive only to my practice. The Center of Excellence in the green light laser technology is a limited designation that is only awarded to treating many patients over many years. My practice is the only Center of Excellence of green light laser technology in the state of New Mexico. I was also the first to bring Resume and have the most experience with it in New Mexico. I have also been doing the Eurolift procedure for years, and it is one of my favorite minimally invasive procedures to offer. So please call 505-727-6200 and ask for a consultation with me. I personally thank you for your time, and hopefully you learned something new today. Please let me know how I can offer assistance, and have a great rest of your day.